So the question is, do you remove implants if needed, and does the free consult cover the procedure? And it is a bottom right implant, molar implant, and which is about 10 years old. So to answer your question, we do remove implants in our office. The question would be, why would you need to have the implant removed? So if the implant is badly infected or the implant is badly broken, and if nothing can be done to salvage the situation, yes, of course, that implant need to be removed. Yes, we can do a free consult for you in our office to cover that procedure, whether it is a bottom right implant or implant in any part of your mouth. However, without seeing the implant, I can't really tell you whether it is a broken implant or a failing implant that cannot be salvaged. But what I can tell you is a lot of times that we see patients in our office, they think the implant is failing, but when they come to our office, we are able to salvage the implants, and we do a variety of procedures, including one of the most innovative procedures we do in our office is the laser therapy around the implants, and particularly the laser therapy for the failing implants. Particularly if you are going to have a prosthesis that is holding onto those implants, and you don't want to definitely lose those implants, end up not having to have a good prosthesis in your mouth that is not staying well. So if you do have a problem with the implant, before you even consider removing, come and see us for a consultation, whether we can help you salvage the implant using some kind of a laser therapy or some kind of a periodontal gum procedure, or if we have to remove the implant, and we highly recommend we do the bone grafting also at that time. So any kind of procedure related to either a failed implant or a broken implant, would be glad to help you.
All right.